Hi there, I'm Taylor.
I'm Brittany.
I'm Reese.
I'm Stella.
We are doing scenario 1. The problem present in this scenario is that Mr. T is disrupting other patients due to his dementia symptoms, resulting in an ethical debate between nurses to provide an appropriate level of care. This situation causes a conflict between Anna, RN of 15 years, and colleague Brett, RN of 2 years, as Anna wishes to deal with the situation through aged methods of practice using biological and physical restraint. Brett, on the other hand, believes that these interventions are far from best practice. He wishes to explore further interventions based around a whole-person holistic approach, which would take into consideration how restraint of any kind could make him feel further agitated, drowsy, confused, and could pose as a greater risk for his health due to falls and further complications. Aspects to consider when providing care for Mr. Taupo is to incorporate the patient's rights from the Code of Health and Disability Services Consumers' Rights 1996. It is the nurse's duty to uphold Mr. Taupo's rights as well as the other patients when providing care. Some of these include the right to be treated with respect and free from discrimination, coercion, harassment, and exploitation. The problem with Anna's intended care is that she would not be upholding the patient's rights as well as the Nursing Council of New Zealand Code of Conduct. There are 8 principles forming the framework for this code, and they are all of equal importance. But for time's sake, here are a few of the principles that directly correlate with this situation. Principle 2 is around the respect for cultural needs and values of health consumers, as this needs to be incorporated to Mr. Taupo's care. This is due to his Samoan descent. Principle 5, respect for health consumers' privacy and confidentiality. Principle 6, to work respectfully with colleagues to best meet health consumers' needs, which needs to be outworked between the conflict between Anna and Brett. And finally, Principle 8, which is to maintain public trust and confidence in the nursing profession. This code of conduct, alongside the Nursing Council of New Zealand Code of Ethics, will be discussed further on by Stella.
Mr. Taupo is showing key warning signs of dementia as he has a decreasing attention span, is becoming forgetful, is unable to sleep, and experiences confusion regularly. Dementia occurs when a person gradually loses certain functions of the brain due to physical changes in the structure of the brain. A combination of symptoms may occur and vary from person to person, as does the rate of deterioration. Many patients will eventually need assistance carrying out basic activities of daily living, such as dressing, feeding, and toileting. The number of dementia diagnoses are increasing rapidly, with an estimate that 131.5 million people will be diagnosed by the year 2050. Therefore, nurses must obtain a comprehensive understanding around the quality provision of dementia care to improve health outcomes globally. When caring for a patient with dementia, nurses will encounter challenging physical and verbal behaviour exhibited by the patient, and thus must be kept up to date with best nursing practice through staff education on managing these types of behaviour collaboratively with the healthcare staff and ensuring that patient safety and patient-centred care is upheld. The registered nurse involved in Mr. Taupo's care, Anna, has suggested that he is strapped to his bed and given a higher dose of sedative in order to keep him in his bed. Studies show, however, that by using alternatives to restraint, better patient outcomes can be attained, and also patients are less likely to become agitated and aggressive and feel misunderstood. This can be achieved by a nursing practice that strives to form and maintain a healthy patient-nurse relationship, built on respect of the patient's values, their right to individual autonomy, a mutual respect and an understanding of the patient's personality and habits, which may compensate towards the patient being unable to express their wants and needs clearly. Furthermore, increasing drug dosage in the elderly poses significant risk, as they are more likely to have renal and hepatic dysfunction, which may lead to accumulation of the drug in the body, resulting in drug toxicity. Therefore, any changes of Mr. Taupo's medications must be carried out carefully and with the appropriate measures taken. Mr. Taupo is clearly unaware that he is violating patient safety and privacy by entering other patients' bed spaces, and as a result disrupting and upsetting other patients on the ward. In terms of the demographic figures, Mr. Taupo is a 79-year-old male of Samoan descent, and it is not stated what ethnicity the 2 registered nurses, Anna and Brett, are. Mr. Taupo's level of education is not stated. We can assume that both Anna and Brett are aware that this is an ethical dilemma that must be dealt with professionally. It is not stated what familial relationships Mr. Taupo has, therefore we cannot assume that he has any support from family or friends. The institutional setting of this scenario is in a medical ward at the hospital. The nature of a medical ward is known to have many varying patient cases of all ages and descriptions. Therefore, Anna and Brett must ensure that their nursing care is specific to each patient and ensures the best possible outcome. In terms of policies and laws, the Health Practitioners Competence Insurance Act 2003 is a legislative framework for all health practitioners with the purpose to protect the health and safety of the public. The HPCA Act contains major concepts from previous legislation, such as the Medical Practitioners Act 1995, to ensure consistency of care across all health professionals. The Nursing Council of New Zealand works directly under the HPCA Act, as it governs the nursing practice within New Zealand. The Nursing Council of New Zealand Code of Conduct sets out standards of practice that all nurses must adhere to. It is made up of 8 principles based on the values that undermine the nursing profession, as well as the 3 principles of te tiriti o waitangi, partnership, protection and participation. The New Zealand Bill of Rights Act 1990, which ensures that patients are not to be subjected to cruel, degrading or disproportionately severe treatment or punishment which Mr. Tupou may be subjected to if he is restrained without proper consideration. The Code of Health and Disability Services Consumers' Rights 1996, which establishes the rights of all consumers and ensures that they are constantly being upheld by healthcare professionals providing care to them. The Crimes Act is a critical piece of legislation and must be taken into consideration. Section 151 of the Crimes Amendment Act 2011 reveals that everyone who provides any care or charge of a person has a duty to prevent and protect them from injury or harm. This applies to nurses who are in charge of a vulnerable adult such as Mr. Tupou, as it is their duty of care to protect and promote health to a patient, ensuring that no unjustifiable restraint, actions or any harm is occurring. Secondly, whilst the Crimes Act may seem a severe course of action for what an outsider may simply perceive as a confused old man, it is the nurse's duty to outwork a holistic approach considering all aspects of the patient's current situation and environment, as well as that of the other patients. This reduces the risk of harm to bystanders, other patients, from Mr. Tupou due to his situation being managed appropriately. The Ministry of Foreign Affairs and Trade 2019 states that as a nation there are 7 treaties that New Zealand implements. These are civil rights, elimination of racial discrimination, elimination of discrimination against women, degrading treatment or punishment, children's rights, disabilities rights and economic, social and cultural rights. Specific to Mr. Tupou, the disabilities rights alongside his cultural rights are to be implemented when providing his care.
Cultural safety is a useful lens for resolving Mr. Tupou's dilemma. In order to provide ethical care for Mr. Tupou, it is important that the ethics of the healthcare system do not take precedence over the ethics of Mr. Tupou. In order to consider the ethical needs of Mr. Tupou, healthcare practitioners must understand their own cultural assumptions, and Mr. Tupou's social and cultural needs must be taken into consideration. D'Souza notes that within Western healthcare there is a tendency to prioritise biomedical interventions over interpersonal ones, and that this may be informing the perspective that Mr. Tupou should be chemically restrained. Another useful framework is the principles of biomedical ethics. Important principles to consider are respect for autonomy, beneficence, non-maleficence, and justice. Mr. Tupou's autonomy will be compromised if he is chemically restrained and strapped to his hospital bed. Beneficence means maintaining the comfort and safety of other patients on the ward. By restraining Mr. Tupou, beneficence may be achieved. However, harm would be done to Mr. Tupou if he is restrained. If Mr. Tupou is physically restrained, he will have his autonomy compromised and may become further agitated and made to feel unsafe in the hospital environment. Furthermore, if Mr. Tupou is chemically restrained, he may become even more confused and be a higher risk for falls. This added confusion may lead to increased incidents of antisocial behaviour and exacerbate the problems it is trying to solve. Considering the principle of justice, Mr. Tupou's family may also have their faith in the healthcare system compromised via their knowledge of this restraint. Seeing a loved one restrained is a potentially traumatic experience. Pacific populations are already notorious for having a lack of faith in New Zealand's healthcare system, and assuming Mr. Tupou's family are also of Samoan descent, Restraining Mr. Tupor may exacerbate this problem by discouraging his family's engagement with the system. Any act that compromises the likelihood of Pacific people engaging with the health system in Aotearoa exacerbates the existing problem of poor health outcomes for Pacific people.
A nurse's duty of care is a legal, ethical and professional obligation in all circumstances. This goes for both Mr. Tupor and all other patients. As registered nurses, it is Anna and Brett's responsibility that best practice care is provided to all patients in the medical ward, including those that Mr. Tupor is disturbing. All people accessing healthcare services have rights set out in the Code of Health and Disability Services Consumers' Rights Act, as stated previously. There are 10 rights in the Code of Rights. Whilst all of them relate to Mr. Tupor, here are 3 that I'll expand on. The first is the right to be treated with respect, as it is paramount regardless in any situation. The third right speaks of the right to dignity and independence, as it ensures that patients are valued as a person. If Anna outworks her plan for restraint, this right will be compromised. The fourth right is that all patients have the right to receive good care and support that suits the patient's needs, which is specific to them. Collectively, all 10 rights ensure that the care provided is patient-centred and upholds dignity and humanity. A culturally competent nurse will see how through these rights, the values, whānau and culture of a patient is essential when providing care. When working with a client who identifies with Pacifica culture such as Mr. Tupor, best practice states that the nurse will provide care through involving and understanding the importance of relationships and interconnectedness of the whanawhali health and wellbeing constructs, which is a model which we're going to talk about here. Specific models such as this are culturally sensitive, safe and holistic, which inevitably produces relevant care which will be provided for Mr. Tupor. This model is a hut, as you can see on the slide, and it consists of the foundation, the pau, the roof and the cocoon. The foundation represents the family, which this includes all extended family and is of fundamental importance, hence the suggestion that Mr. Tupor's family should be involved in his management of care. The pau, this consists of the 4 posts connecting the family to culture, visually representing how they are interdependent. The 4 posts are physical health, spiritual health, mental health and other health. When one pillar falls, the rest suffer. The roof represents their culture, beliefs, traditions and social norms. This shelters the individual and protects their health and well-being. The cocoon includes 3 interrelated dimensions that affect the health and well-being of a patient. The actual or specific time in history that impacts the Pacific people, the relationships between Pacific people and their environment, rural or urban. The where, what and how includes factors like socioeconomic situation, geographic location, basically what's happening in the big picture of their life. By involving these aspects when creating a care plan for Mr. Tupor, interventions are more likely to be effective and will help with his agitation, enabling him to feel supported, respected and safe.
It is clear that there is an ethical dilemma here. The nurses need to find a way to appropriately manage Mr. Tupor's actions in a way that provides effective patient care for everyone involved. However, there is no clear right or wrong solution. Mr. Tupor should be shown respect for his rightful autonomy, and nursing staff need to ensure that they cause no harm to him or other patients by not managing his disturbing behaviour adequately. The courses of action proposed by Anna and Brett are likely to benefit one party but at the same time inadvertently cause harm to the other. Part 6. Guidelines from the New Zealand Nursing Council and the New Zealand Nurses Organisation are both applicable to both viewpoints. Principle 1.2 of the New Zealand Nursing Council Code of Conduct states nurses must take steps to ensure the physical environment allows health consumers to maintain their privacy and dignity. Anna's actions could be seen as ensuring this principle is carried out by trying to stop Mr. Tupor's wandering. An equally valid point here is that physically restraining him to the bed on a shared ward removes his dignity. Principle 1.10 states nurses must take steps to ensure care does not harm the health or safety of others. In voicing concern around Mr. Tupor's restraint and delayed sedation effects, Brett is adhering to this principle, and it can be argued too that seeing Mr. Tupor restrained and hearing his agitation could cause distress for other patients. But is further bound by Principle 8.4 in this aspect. Document and report your concerns if you believe the practice environment is compromising the health and safety of health consumers. If Anna's intended plan is carried out, BED is obligated to officially document and report these views. The NZNO Code of Ethics states that nurses are responsible for making sure the care they provide reflects current industry-wide best practice standard. Having just returned to nursing after 15 years, Anna may be suggesting interventions that are no longer viewed as the safest course of action. It is her responsibility when returning to the workforce that she familiarises herself with changes in policy and practice. This is echoed by the New Zealand Nursing Council and its competencies for registered nurses. Under the domain of professional responsibility, the first competency is around keeping practice in line with current ethical and legal standards.
In order to decide on an appropriate course of action for addressing Mr. Tupou's behaviour, an interdisciplinary process should be undertaken. Assuming Mr. Tupou has a strong Samoan identity, Mr. Tupou's family should be incorporated into the decision-making process, and if possible, Mr. Tupou himself may want to be included if he is in a state of lucidity. There may be diversional therapists or other specialists who have expertise in the management of problematic behaviours from confused patients that would be worth consulting. Healthcare assistants should also be included, as they may be spending the most time with Mr. Tupou and have already developed strategies for managing his behaviours. Along this same line, other staff, including cleaners, kitchen, or other staff that interact with Mr. Tupou may be worth including. A Samoan cultural advisor should be consulted to understand if there are any cultural considerations of significance. Both Anna and Brett, the two registered nurses who have disagreed on how to manage Mr. Tupou, should be included in this decision-making process.
Step 8. Current evidence points to the use of non-pharmacological solutions in situations like this, in particular creating a behavioural management plan and stable environment which minimises exacerbation of symptoms. As dementia is such a complex issue, managing risk patients requires multidisciplinary coordination with whānau involvement where possible. It has been noticed that most patients exhibit specific warning signs, so a clear, detailed plan of action for when these signs present is key. Dementia patients are more vulnerable to being affected by changes in the environment, and inconsistency can lead to frustration for them and family, so a team-based approach is important to provide a consistent foundation for the patient to feel grounded. Making environmental changes such as light therapy and keeping a clear, tidy space with familiar objects close to hand can aid the success of this plan. Involving family where possible is important, as often dementia patients find it difficult to grasp the situation, so having as much familiarity as possible can aid understanding and lessen agitation. This familiarity can be further utilised in use of simulated presence therapy, although these measures are of course dependent on close family relationships and the logistics of their involvement. An alternative option is to look at less or non-sedative pharmacological interventions. Melatonin can aid dysregulated sleep patterns in dementia, and cholinesterase inhibitors have found to decrease disturbed behaviour in dementia patients. These medications, combined with a sedative that has a shorter half-life, such as triazolam, will have less ongoing effect the next day and may be successful in managing Mr. T's nighttime disturbances. There are, however, arguments that prescribing more medications to dementia patients can be unsafe, and they are likely to be overprescribed. Given that polypharmacy is more common in older patients, which increases the risk of drug interactions, and that age-related pharmacokinetic changes may affect reactions to drugs, this option is the second best choice. Based on the evidence, the most ethically sound course of action would be to compile a multidisciplinary team comprised of nurses, doctors, diversional and occupational therapists, healthcare workers and family to create a plan of action for Mr. T. This keeps in practice with guidelines and also of research that proposes non-pharm approaches to be the first line of choice of treatment. The plan would involve identification of Mr. T's early warning signs and confirmed action to be used in this situation. Also, the selection of 2 to 3 healthcare workers and 1 nurse who are assigned to his care. Keeping this consistency among staff is an important part of risk minimisation, as changes in the environment are known stressors. If Mr. Tupou's family are able to be involved, their presence will similarly provide familiarity on which these interventions are based. The use of simulated presence therapy can also be utilised even if the family is not able to be involved. This could be done by making a recording of a well-liked story or a song to be played in times of unrest. Diversional therapists and occupational therapists both have knowledge unique to managing the difficulties of living with dementia and can provide practical input into making the ward into a safe space for Mr. Tupor and other patients. While it's important to build a holistic picture, a scientific medical-based perspective is needed, so having a doctor's input is a crucial part of this process. Also, this proposed course of action may not be successful, so pharmaceutical action may be necessary, which furthers the need for a doctor to be involved.
By incorporating a diverse range of disciplines and voices into the decision-making process, there is likely to be a more thorough exploration of treatment options for Mr. Tupor. Interventions such as diversional therapy and using key workers for Mr. Tupor promote his likelihood of complying with medical staff during periods of confusion and antisocial behaviour. These interventions have the added benefit of being less likely to compromise the relationship Mr. Tupor and his whānau have with its staff than physical or chemical restraints would, whilst also being more likely to be deemed culturally safe. There may be instances in which Mr. Tupor continues to display behaviours that may be unsafe to himself or to others. In these scenarios, if due legal and ethical course is followed, it may be appropriate to restrain Mr. Tupor. However, this should be as a last resort. If there is a decision that restraint is an appropriate course of action, there would need to be discussion with family members, and a person with enduring power of attorney would need to agree for the restraint to take place. There would also need to be consideration of how the restraint would impact on the well-being of other patients and visitors to the ward, and plans put in place to minimise the distress of patients on the ward as well as visitors to Mr. Tupor.
Thanks for listening.